Welcome, welcome, Sandra. It's such a pleasure, such an honor to have you here today. It's like a full circle moment for me. And yeah, I mean, I started with FMCA all those years back in 2017, your second cohort, and the first functional medicine certified health coach in India. So I can't tell you how excited I am to have you here today. Welcome, Sandra.
Thank you so much. The pleasure is mine. It's a joy to be with you, Anandita.
And before we get started, a little introduction for those of you who may be new to what Sandra has done. Incredible work. Dr. Sandra Scheinbaum is the founder and CEO of the Functional Medicine Coaching Academy and a leader in the in the field of health coaching, an educator, clinical psychologist, author, and public speaker for nearly 50 years. And this is the part that has inspired me the most, that you founded FMCA at age 65, and you're on a mission to grow health coaching profession so that millions of people actually get the support they need, that they deserve to lead healthier lives. And that's why we are both here today, to talk about coaching, to talk about FMCA and your book. Actually, I mean, I wanted to also talk about that. Your health coach will see you now. I love the title of the book. So would
Thank
just
you.
like you to share about, those who are new to you, your mission, the reason that you built FMCA, whatever you would like to share to get started.
Well, thank you for that introduction. And yes, I have been in this field for nearly 50 years. I was a clinical psychologist and I was a health psychologist. And so I saw people who were diagnosed with physical conditions such as migraine headaches, for example, or irritable bowel syndrome, and found that focusing on how they live their lives day to day made the crucial difference. So it was not getting a pill for every ill. It was not having somebody tell you you have a diagnosis, you're broken, and you need to be fixed, which is what often happened even in psychotherapy world. But the idea that these simple things that could be changed, you could change your daily habits. And what are those areas? Those areas have to do with the food choices you make, how you move throughout the day, and what exercise you're doing or not doing, your sleep. Are you prioritizing sleep? As well as stress that's in your life. How are you interpreting the stressful events that inevitably take place? And what are your relationships like? Do you have meaningful relationships? Do you have meaning and purpose in your life? And if you address those factors, then your health improves substantially, not only physical health, mental health as well. And what we have seen is the explosion in chronic diseases. These are the diseases that modern medicine is not equipped to take care of. So, if you feel you might be having a heart attack, or if you break your leg or you think it's broken, you get the best of medical acute care medicine. That is what they excel in, which is increasingly being driven by AI. And there's some really exciting developments in that arena. But what about if you are diagnosed with one of those chronic conditions, like type 2 diabetes, for example? What if you are overweight and you don't have to be weighing a lot as measured by a scale? You can be skinny fat. And I was one of those where you look skinny on the outside, but you have a lot of fat on the inside. You are under muscled. And that is a big problem. And that often leads to disease states. And these are the conditions that are not easy to fix in acute care medicine. In other words, it's not a simple matter of just like, oh, taking a pill and you will be fine, because these conditions tend to lead to other conditions. And so what we do in functional medicine is we dig down to the root causes of these conditions, which are often inflammation. What drives the inflammation? It often is those lifestyle factors that I mentioned. And so that's where the health coach comes in. They are the ones who address lifestyle. They're specialists in behavior change. And the way they do that is often remarkably simple. It's listening. People often don't feel heard. Often they don't feel heard by their doctors. We're facing an incredible shortage of doctors. And so the health coach is that human touch, that human element where you are feeling listened to, heard, and understood.
I think, you know what, when you were, because I've been through the training, so I can completely relate to what you're saying. But I think one of the things that I want to go back to when I did my FMCA training, and we'll come back again to the present, is I thought I knew how to listen till I started the program. And as coaches, we are taught how to listen. And I think you're absolutely right. And you've talked about bedside manners in your book because that's something that has gone missing. And there are multiple things, of course. There is that, that there's no quick fix or there's no one factor for chronic conditions. That is why you cannot go and get a prescription, take a medicine and get well. That it doesn't work like that. And the other thing is, you're right. People are not just being heard. And healing starts when, people feel heard, people feel seen. So, if you can just take us back as to when you started FMCA, what did you envision that this movement would become? And where are we today, and and what made you first realize, you've talked about it a bit, but you want to share that healthcare need health coaches just as they need doctors. So
Yes. Yes. So my vision, which still today, is to see a health coach in every doctor's office. Let's take one example, and that is menopause. The average person today going to medical school gets about, the average medical school would get about 4 hours. That's it in menopause. We have a whole generation of doctors who are gynecologists, and they are not trained in menopause. They are trained to do procedures. They are trained to give out birth control pills, for example. But as far as this whole population of women in midlife and beyond, they do not have the training. And of course, we have changes that have taken place where initially we had the Women's Health Study, which showed that hormone replacement causes cancer and other issues. So people were scared and doctors were scared to prescribe. And to a large extent, that's true today. And so what health coaches do, in addition to being those listeners, they're the ones who can provide education. They can support people if somebody is confused, like, I don't know, is this, tell me what this means. I see the headline that, for example, in the United States, the FDA, Food and Drug Administration, removed the black box warning, which was this danger sign on a box with hormones saying that, oh, this will cause cancer. And they removed that. But because people might be very confused. And so health coaches can provide clarification. And what's most important is what's so magical about coaching is that that individual that they are working with is in the driver's seat. They are the ones taking charge. And so what happens in health coaching is people feel empowered. Self-efficacy comes up over and over again in the research. And what that really means is that someone feels like, I can take charge of my health. Often people think, oh, it's all in my genes. It's my genetics, my family history. There's nothing I can do. I have a history of heart disease, of whatever it might be, and I can't do much about it. And the working with a health coach, you have that dawning recognition. Yes, I can make these changes now for my future self. And so I don't have to be this victim, or I don't have to be just at the mercy of whatever the doctor recommends. There's a colleague, Dr. Erica Schwartz, who has written a book, and she just revised it. It's an older book, but it's called Don't Let Your Doctor Kill You. And in other words, you become your own advocate and you ask questions. You don't just accept, oh, the doctor is always right, I'm in your hands, doc, but really looking at how you can take control of your health. and your family as well, where you are going to see the changes that can take place when you make these lifestyle changes. So, again, my vision is to see millions of health coaches, every doctor's office having a health coach, or every person having their own health coach.
I just love that vision. I have to tell you that it sort of just warms my heart. I know that you've shared that, but it's so nice to hear that, this is what we are moving towards. And I am really proud to be a part of that movement as well.
Mm.
We do need that. We do need health coaches. And I think one point that you mentioned, which is so critical, which we don't really talk about in terms of self-efficacy, which is what is actually critical for managing chronic disease, right? Acute conditions are very different, like you mentioned earlier, but in the case of chronic disease, in fact, it's quite funny in the sense that I had recently reached out to a past client because I had created a separate group for a new program that I'm doing. And when I reached out to her, she last worked with me 3 years back, or two or 3 years back, and she said, Anindita, actually, I'm doing pretty well. Whatever we did in our time together is pretty much working for me. So I think I am fine right now. It's like, wow, okay. It's like some of the things that we do with our clients as coaches are so transformative. They are these are sustainable tools that we give them, I think, and
Yes.
that's really, really powerful. So I just wanted to share that, and that's hats off to the training, the FMCA course and the program. And so just what basically I just wanted to also bring about a bit of a focus on people who want to be coaches as well. One is from the client point of view, of course, the clients that we work with, but someone who wants to become a coach, how would FMCA be able to help them? So I want to sort of, move from both directions, I would say. If you can
Sure.
just share.
Well, yeah. So, what I absolutely love about this profession is that it is so accessible. You do not need to have any background whatsoever in healthcare. In fact, we have some of our best coaches were not nurses or doctors or nutrition professionals. They were not in healthcare. They might have been lawyers. They might have been, we've had farmers, we have firefighters, we've had paramedics, we have people, well, actually, you could say paramedics is a healthcare, but the people who are coming from corporate world, they've been executives in corporations. They've come from the tech world. They have come from marketing and advertising, and they have been moms who are raising their children and not working. And they have gone through the program. The other thing is that there is no age barrier. So for many people, when you go to graduate school, they think, oh, they're too old, or we have had people ranging from just out of college or even no college. And they are right out of high school sometimes. And we have people in their 80s. And even we had a gentleman who is 90 years old, and he went through the course recently and graduated with his granddaughter.
Oh,
And so she ran a preschool, and she wanted to turn that preschool into a center where the whole family could come in and get healthy. And he was on board. So we've had so many people like that. And the other thing is that in terms of accessibility, it is affordable compared to what you would spend to get a graduate degree. So to go to school and get, let's say, a master's or a PhD in nutrition, for example, or my experience to become a psychologist, that is a long road. It's and then doing a dissertation and an internship. It could take years, and it is quite expensive, and you have student loans when you come out. And so this is something that it's a certificate, and you don't have to stop what you're doing. We have people who are raising a family, they're working full time. And we had one woman early on, she was homeschooling 5 children, and she was also working. And so it is doable on so many levels. So that is why I really love it. And we have people
um,
from all over the world, 92 countries now we
oh,
have
wow.
represented. I know.
I'm So, I mean, it's so nice to hear that. And I am one of those examples who does. I mean,
Yes.
I didn't come from a medical background. I came because my daughter was unwell and I was
Yes.
looking for a solution. And then I'm very fortunate. I first came across functional medicine and eventually health coaching. And we are having a conversation about that. And yeah, and I think one thing that you mentioned, I mean, I wanted to go back to that is the ripple effect. It's not just that one person who changes, whose life changes for the better. And I've seen it happening time and again. And I wanted to talk a little bit about that because I think we underestimate the power of coaching, is the effect that it not only has on that person, but on the person's family, on the community. And I've seen that happen. So would you like to share a bit about that? I'm sure you
Sure.
have more examples.
Sure. So first of all, when you study to be a health coach, and I know you found this, you yourself are transformed because every time you are with that individual that you are coaching, that interaction, that encounter will transform you. When you are with somebody and they have that aha moment that they're ready to change, that is so powerful for your sense of meaning and mission and purpose. And that the skills that you learn as a health coach, the communication skills, how to ask questions instead of just always thinking I'm going to jump in and tell someone what to do, then you start to practice that with your own family and friends and colleagues. And for the person being coached, they will start to make some changes, and that ripple effect is so strong where their families will now start picking up that. And for example, the foods that they're choosing, or they might be going out and walking together. But first and foremost, it's a sense of having meaning and purpose in your life. And we use a model, which you know, it's character strengths, and being able to say what's right with me as opposed to always thinking I'm damaged or there's something wrong with me, which is the medical model. That is extremely powerful, and it does have that ripple effect. And even to your community, we have people who are going out and making a real difference in their community, often giving talks to the community. You know, you have done that. You've written a book, and you've started the podcast, and reaching out and having that ripple effect.
Yeah, it's huge. It's not small. I mean, that's the reason I wanted to talk about that. And the other thing that I wanted you to touch upon is because I find this when when I talk about coaching, whether it's to my clients or explaining what coaching is and how it can change lives, even to practitioners, is the feeling that coaching is about giving advice or only about education. There are a lot of myths around that. So I know you've trained thousands of coaches. I mean, I would love to know how many coaches the FMCA has trained till now. So but what common mindset blocks have you seen both in clients and coaches that might, keep them stuck? So they might be two different things, but I would love
Mhm.
to know that actually.
Sure. Well, they're related. They both have to do with coming in with an agenda, having a preset determination. So, on the coach's part, let's say you have a strong belief in being a vegan. And
Mhm.
so, even if you're trying hard to be open minded, you might be, even through your body language, you might be conveying a message that you are communicating that this is the way to become a vegan. And in coaching, the beauty of it is totally what that person wants. But what people come into coaching, they have been to so many of the experts, often a series of doctors who give them that diagnosis and tell them what to do. Here's your treatment plan. This is what I think you should be doing. Here's what you should be eating. Don't eat this. Exercise more, lose weight. This is how to do it. So they're being given advice. And for we know that that doesn't work, because if it worked, we would be really healthy, and everybody, we wouldn't have skyrocketing rates of obesity and type 2 diabetes and Alzheimer's disease, for example. And so the giving advice is something that there's a place for it, but the beauty of coaching is that it is taking that of having that person really look at, well, you've gotten all, this is what your doctor recommends for you. I want to hear, what do you think of this? And tell me what parts are doable. Tell me what parts are absolutely no go for you. And we'll work out a plan. And so it comes from that client. Now, they might say, my doctor said this, and I don't quite understand what this means. They said I have this condition and I have to do this. Tell me, what I have to take this supplement, this vitamin. What is it for? And so there the coach will step in and provide that. Or they say, may I make a suggestion? There's some things you could do. Tell me if you're interested in this. And so those are ways that it's a dialogue, it's collaboration. It's not the coach is up here, they're the authority figure, and you are and we say client to show that coaches are not medical doctors. They have clients instead of patients. So they have, but it is a sense of this is an equal partnership.
Absolutely. It's a partnership. And actually the
Yeah.
example that I have sort of created for myself, because it's hard for people to understand, especially in our part of the world, what health coaching is, let alone what functional medicine based health coaching is. So I think the example that I give them is that if you were to suddenly decide to go up trekking up the mountain and you've never trekked before, I am that guide that can sort of help you. I am not, but and then I tell them, okay, I'll be supporting you when you need to. I can let go when you don't need my support to that extent. So it's like a partnership. It's a collaboration.
Mhm.
But and this is the most important point. I am not doing that climb for you.
Yes.
You are the one that who's doing the climb.
Absolutely. Yep, that is the key. And you had mentioned how many we have trained close to 5,000
Oh,
graduates now since we
wow!
started and growing.
Congratulations!
And
Congratulations!
we need so many more.
Yes.
And we are now having so many companies and people coming to us wanting health coaches.
So, what do you envision for FMCA? I mean, because I'm going back and forth a bit because I want somebody who's listening to this or watching this, and if you are and you want to become a coach, there will be, I'll share the links below. Or if you're looking for, support in terms of a coach, you'll get. I'm hoping that we'll get something from here. So, what is your vision for the next 10 years for FMCA? I mean, what are you thinking? Do you have any plans for India in particular? What are your thoughts? I would love to know.
Yeah. Yeah. Well, we want to grow our community around the world. And so our plans are we are also we support our graduates. And so we have the people are coming to us increasingly because it is now, unlike when we started about 10 years ago, there is a movement for direct to consumer labs. Now, some of these companies are based in the United States, and at the present time when this is recorded, they may not be offered around the world, but that will change. And in other words, the doctor is becoming more like the consultant. And we are seeing that somebody can go make an order, a full suite of functional medicine lab tests online, and they can go to get their blood drawn and then they get the results. We're seeing the growth of AI in being able to the AI is better at a diagnosis than an individual doctor, and this is coming. And so this is feeding into this sense of people taking charge of their health and getting with AI precision diagnoses and be able to then make these kind of changes. But the problem comes in, and why we need health coaches is that you're getting all this data and it can be overwhelming. And the average person might give up. This is so confusing. I don't know what to do. I don't know where to go. I need support. And that's where the coach comes in. So they don't order the labs. They're not trained to be medical doctors. We have many doctors, though, who are health coaches, who are coming to be health coaches. But if you do not hold a medical license, you provide that support for somebody where they can become their own advocate and they can say, okay, I'm going to ask for this from my doctor, or the AI report is showing this. Let's have a conversation and see how you feel about this. And so they're that critical role. And so we are having this relationship now where companies will be able to have a coach when you get these tests. And that's a trend that I'm seeing right now, where coaching is just catching on. And for many people as well, who need mental support, we have a mental health crisis. And it started it was a little bit, but before the pandemic, but now it's just that really accelerated the need. And there are not enough therapists. There are not enough people who are in mental health field to support people that are in need. And we have studies coming out that show you have a coach, your anxiety and depression are going to improve. And we're not talking about that population that might be severely manic depressive or schizophrenic that needs medical care, psychiatric care. We're talking about somebody who is just experiencing a little bit of depression. They feel like lost. They feel like nothing's working for them in their life. They get a health coach, uses a positive psychology model and the connection between, gee, what you're eating, or maybe, walking, exercise is the best antidepressant. It's better than any medication. And so having that coach helping you in these areas, you're going to find that your mood is so much better.
I think that's a really, really important point, especially as you said, after the pandemic, where the mental and emotional well-being has been severely affected for so many
Yeah.
people. And I mean, I can speak from personal and professional experience as a coach as to the efficacy of the coaching, program in terms of mental and emotional health. And I think, you're right in the sense that, there's so much of suffering can be prevented. It's not just when they already have full blown depression, anxiety, etc. And again, some people will need medical interventions, and that's fine. But so many others could benefit from coaching in terms of prevention of these kind of this kind of pain and suffering. So yeah, so that's really critical. One thing just struck me when you were talking is that what are you seeing in in the this is I'm actually personally interested in the field of AI and coaching. I mean, how do you think that's going to sort of pan out? What are you seeing? What are the trends? I would love to know.
Sure. So I write about this a lot in the book because it seems like every company, Apple and Samsung and Whoop and Aura, the Aura Ring, they are all developing an AI health coach. And here's the problem, that they are providing advice. They'll ping you about, and or ask about something that you can keep tuning out. Like, did you go for a walk today? Or they will look at your sleep data, and then they will say, this is what you need to be doing. And so the premise of coaching is misunderstood when you read some of the press releases and interviews about they're excited about what's in development, but it's not really coaching, because coaching is a human interaction. It doesn't have to be face to face. It can be virtual, or it can even be even just on the phone, for example. That's been shown to be powerful, but it's knowing that here's a human being who cares for you. And it would be I liken it to the experience, and we've all been there, I'm sure, where you are trying to get customer service of a big company, maybe it's a cell phone company, and you are just given a bot to talk to, and you're trying to say, representative, I need to speak to. I had that with an airline. My flight was delayed or potentially canceled, and I had called, and the messaging that I was getting was not meeting my needs. And so often people they're yelling, representative, I need to speak to a human representative. And that delight you feel when a real human being comes on the phone and says, hello, this, how am I, and you hear that human voice. And also groups, you mentioned the group. A bot, an AI health coach, is not going to lead a group, for example. So again, it's a heart-centered communication, but also that there can be a role as we are getting information from our wearables. And that can be very helpful. So it's not either or. It's a human touch, a human health coach combined with the best of technology and AI.
And yes, it's actually a combination. And I think the other thing that I wanted to explore a little bit more is the community part, because we haven't really talked about that. The group coaching, I know you talk about it in the book, and I know that it works amazingly, especially when someone's going through a health crisis or has been dealing with a chronic condition for a long time. It can be really isolating. It can be really lonely because, and I've had clients like that, and they tell me that, because I look fine from outside, nobody really understands what I'm going through. And I think coaching
Yes.
can be really powerful tool. Community. I mean, that's the point I was making. If you can just share a bit about that, anything.
Oh, absolutely. Community, I think, is the key to well-being. When Dan Buettner studied the blue zones, those are areas around the world where people live long, healthy lives. And what is in common is that they are all strongly focused on community. We are social beings. And the ability to get together with others. And so there are several levels of this. One would be eating in community versus eating alone. I was at an event and I went out to one of the restaurants nearby. And so I was eating alone. And then somebody at the next table recognized me. She was somebody who was also at the conference. And she said, "Oh, don't eat alone. Come and join us." Night and day. I'm sure my digestion improved because I was eating with others. And so having that community and often finding your community because I'm 75 and often it's hard to find community. That people are getting sick, they have ailments, many friends have passed away, and so your community narrows, and this is a big problem with older individuals. But people who are social, people who go out, and it's more important than the food you're eating, for example. It is having that community activities that you love. So when you pair it, I take ballet dancing. We have a good community. We have get-togethers. I'm in a craft circle where we will get together once a month. People bring their knitting or needlepoint, and it's just sitting around. And people for hundreds of years, that's what they did. They sat around together. They had sewing circles and supported in that way. So, and then there's the community that's formed with a health coach facilitating the group, because that's how change happens so effectively. Because you may be hesitant or you think, but when you see others in the group changing how they're eating, for example, oh, and then you might say, well, if she can do it, I can as well. And also, you feel like you're not alone, that you can share something that's going on and you thought you were the only one experiencing that. And you hear others saying, oh, yeah, me too. That happened to me too. And so it is so reinforcing for your healing journey.
And when you were sharing that, I was, thinking back to where I was about 11, 12 years ago when I was dealing with my daughter's health issues. And I was telling someone the other day that I wish I had a health coach back then. It would have really
Mhm.
helped me. I mean, I did it on my own. It took 2 years. I had the guidance of a functional medicine practitioner, and he's coming on the podcast very soon. He was really, really
Oh.
helpful. But he's based in the UK actually. But however, if I had a health coach at that time, and I'm talking about 2014, 15, 16, 17, it would have really, really helped. And that's the reason I wanted to talk about this a bit more. So
Mhm.
sort of just rounding up our conversation about coaching, about FMCA, and I'm always excited to talk about coaching. I can talk for hours, literally, about coaching and how it works so well. So for our audience who feel so one part is for our audience who feel called to become a health coach. What is the next best first step that they can explore for to reach out to FMCA, and for those seeking support in their healing, how can they what is the best way that they can find a health coach as well? I mean, I would like you.
Sure. Yeah, well, both can go to our website, and that's functionalmedicinecoaching.org. and they can get an information packet. They can get an appointment with one of our admissions team members. And if you are inspired to work with a health coach, of course, there's you, if you would be a good fit. But if depending on where you are and what your needs are and what specialty you're interested in, you can go to, again, functionalmedicinecoaching.org, find a coach. And we have a directory of people all over the world, and you can find somebody that would meet your needs.
Oh, thank you. So I know that in India now there are quite a few coaches. There was hardly anyone when
Yes,
I started, and one of my clients became a coach. Actually, I don't know whether I
I
shared that.
love it. Yeah.
She she
Uh,
became she became a coach in
Fantastic.
the process. So that's
Yeah.
how transformative the coaching process is. And
Yeah.
anything that you would like to share that I haven't asked you, or any, I would
Um,
love for you to sort of bring it all together.
Sure. Well, one other thing, if somebody is listening and they're thinking, I would like to get a coach, I would like to hire a coach for my employees, or maybe I'm a doctor and I am burnt out and I have so many patients struggling with chronic illnesses. You can go to our website and we have a section for practitioners, and you can submit a job request, or you can go to our Find a Coach, and we have a job board for our graduates. And we have, again, more and more companies, doctors hiring coaches. But coaches help people go from where they are to where they want to be. And it literally can transform lives. And I've seen this hundreds of times over and over again. People who are becoming coaches. And you can do this even if you say, well, I'm going to continue my current work. We have people who coach on the side, or who add coaching skills into what they are already doing in their work, or just want the information for themselves and their family.
Yeah, there are actually quite a few people who do that, who end up doing the
Yeah,
program because they want that information to help their
yeah,
family. They may not be
yeah.
coaching anyone else. But that's such a powerful conversation, Sandra. It's coaching is so transformative. It changed my life. It transformed our lives. Let me just use that word. And now, with the ripple effect, it's changing so many others' lives. It has over the years, and I'm so thankful that the FMCA became a part of my journey all those years. And this is my way of giving back and sharing this message with my audience. And, thank you so much, Sandra, for coming here
Mhm.
today and sharing these powerful words.
Well, thank you. Thank you for finding FMCA all those years ago, and all the wonderful work you have done and are continuing to do and will do.
Thank you. Thank you so much.